Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. This week's quick video is to answer the question I hear a lot, and that is, why do I adjust my patient's feet? So I put together a little bit of information just to have more clarity, not only for my patients, but for myself, because I understand the importance of it, but am I really portraying that to my patients? And as a mentor of mine, Jim Rohn, used to say, what do numbers do? They tell us the whole story. So let's look at just some of the bare facts of the feet and the anatomy of it and go from there. So 25% of the bones in our bodies are in our feet. 25%. 38 muscles and tendons in the feet. There are 66 joints in the feet, and there are 214 ligaments in the feet. So looking at volume and numbers and percentages, the feet are really important, okay? So I found a really neat website as I was looking back at, looking up the information. It's foot.com. Never heard of it, never looked at it, but I really liked it. And I'm just gonna read a few things from there that I think are really crucial and important for people to know. So, number one, over 2 million Americans seek treatment for plantar fasciitis or heel pain or foot pain each year. So the plantar fascia is that bottom covering of the foot that can get distorted, get tightened, and by adjusting the feet, we can bring some ease to the tension in that area. And of course, looking up to the knee and looking at the gastroc and soleus, making sure that the foot function is good. Next, what I wanted to look at is 75% of Americans will experience foot problems at one time or another in their lives. 75% of Americans will experience that. So is looking at the feet important? Absolutely, it's important. Next, the average person, now these numbers have changed quite a bit. The average person takes 8,000 to 10,000 steps a day. And what I liked about here, it says, which adds up to about 115,000 miles over a lifetime. That's enough to go around the circumference of the earth 4 times. Okay, so walking is important to us, and we want to make sure that our equipment that we use to walk with, meaning our feet, of course, and then knees and hips, are functioning properly. You know, if you look at, say you're going to buy a house or something, to come out and look at it, one of the first things you're going to look at is your foundation. You want to make sure your foundation is good. Unless you're sitting on your butt all day, our feet are our foundation. We spend a lot of time standing and walking, right? 8,000 to 10,000 steps a day. So now, I love working with runners. I love working with weightlifters. I love working with people who are doing athletic type things. And the pressure on the feet when running can be as much as 4 times the body weight. Now, I'm not necessarily built for running. I'm 200 pounds, but that if I do run, when I do run, we're talking about 4 times that. So that's 800 pounds of pressure when I am running, okay? The next step with that is, you know, doctor means teacher. I say it all the time. Doctor means educator, teacher. So, and one of the things listed on here, and it's so true, neglect and a lack of awareness of proper care of the feet is one of the main issues why people have problems with their feet. So, you know, when we look at foot ailments, they can be the first sign of a more serious issue. So your feet mirror your general health. Conditions like arthritis, diabetes, nerve and circulatory disorders can show their initial symptoms in your feet. Just like I always say, our teeth are so important. You know, get your teeth cleaned every 6 months. You know, get your feet checked at least monthly or a couple times a month. Make sure that your feet are functioning the way they should be. So, why do I adjust people's feet? Because they are a key component in the health and happiness of our bodies. All right. Thanks a lot and have a great week.